Have you seen the recently updated CMS memo regarding nursing home visitations and reopening? This is super important for your nursing home. So today we're going to have a chat about that and what you need to do to prepare to reopen your nursing home facility. Hi guys, I'm Dr. Buffy, and today we're going to be talking about the updated CMS guidance on reopening your nursing home to visitors. If you recall, we did a similar video a few months back regarding the September 17th guidance, and there's been a lot of changes. So today we're going to unpack the guidance for you. All right, so first you want to make sure that you have that QSO 2039 NH memo. It was revised on March 10th, 2021. And what I'm going to tell you is print the copy. There is so much to unpack that you will definitely want a hard copy at your fingertips. I reference this almost every single day. So let's go through some of those changes that I'm talking about almost daily with nursing homes and helping provide them some guidance. First, as always, anything updated in red are the new changes. So that can help you gauge what was changed, what wasn't. Next, you always, of course, want to make sure that you're following your county and state guidelines and ensuring that they align with this CMS memo. So let's unpack this a little bit together. So first we go through and we see that the core principles of a COVID-19 infection prevention, those remain the same. There wasn't a lot of changes to that. We just want to make sure that we're having all of our visitors and guests follow the face coverings, the social distancing, that the high-touch surfaces are being cleaned and disinfected. So that hasn't changed a whole lot. But as we scroll down, what you'll see is really changed a lot is that indoor visitations. And the indoor visitations applies to all of your residents, except if you have unvaccinated residents with your county positivity rate that is greater than 10%, and you have less than 70% of your residents are fully vaccinated. So really make sure you understand where your facility is with the vaccination rates as well as what your community COVID-19 rates are. Next, if a resident is on a 14-day quarantine or they're on a COVID isolation, then they cannot have visitors. Another really important aspect and change to this guidance is that if a resident is fully vaccinated, they can actually hug and touch their loved one. So this is very new. Any visitations that we've had before, we've had to socially distance our loved ones. We've had plexiglass separating them. We've not been able to allow any type of hugging or touching. And so keep in mind that if the resident is fully vaccinated, that they can touch their loved one. Perhaps the biggest change to this guidance is for indoor visitations. In September, we said if we had an outbreak, no more visitations, but that's not the case anymore. So you really want to understand what page 4 is saying as far as the indoor visitations and an outbreak. So basically, if you have an outbreak, which is classified as one new case of COVID-19 in your facility, this could be a resident or a staff, then you have no visitors right away. You go into that outbreak testing mode, and you want to make sure that you're following the testing protocols appropriately. After the first round of testing, if you have no new COVID cases, then the visitations can resume. If you have additional COVID cases, say on a unit A, then visitations cannot occur on that unit, but they can occur on a different unit where there's no new cases. So it's a bit tricky. It's not a blanket, we don't accept visitors anymore. And I'm finding that many nursing homes in their policies are still including that language. And so you really want to update that based on this CMS guidance. Another really big change is for visitor testing and vaccinations. We no longer can have this as a condition for coming into our facility for our visitors. So if a resident's family member doesn't have a COVID test or is not fully vaccinated, then we still have to allow them into our facility. Finally, let's talk about compassionate care visits. Regardless if you're open for visitations or you're in an outbreak, we have to continue those compassionate care visits. So I hope this guidance, I hope this updated information was helpful for you. There's so much to unpack constantly with this ever-evolving pandemic, and so we always want to bring value to you and updated information. We'd love it if you let us know what other topics you would love to hear from us so that we can really be of value to you and your facility.